I went through a hospitalization about maybe 22 years ago. And for 6 months, I wasn't on medication that was working for me. And it's a very difficult situation to be in.
For mental health advocate and author Leif Gregerson, access and funding for medication is critical. Gregerson is one of many Canadians living with schizoaffective disorder, with 1 in 5 affected by mental illness each year. He's hopeful a new report released Tuesday called System Broken: How Public Drug Coverage is Failing Canadians with Mental Illness will shine a light on the shortfalls in the health system, particularly difficult access to newer drugs for people living with mental illness.
There's so many people out there who are suffering, and needlessly, because there are medications that can help them, and they're facing barriers.
The report, commissioned by the Mood Disorders Society of Canada, shows more than half the reimbursement recommendations for new medications for mental illness made by Canada's assessment bodies didn't get approved for coverage for those needing medications for mental illness.
What is really striking to me, though, is that the percentage of mental health drugs that is recommended to be reimbursed is less than other non-cancer drugs. So that was the comparison, showing a clear sort of either stigma or discrimination.
Whether subconscious or not, Couillard says it's concerning, stressing increased mental health awareness should come with better resources. But he says there aren't, with room for federal and provincial governments to act.
If I was to have a sit down with the head of Alberta Health and, Ms. Smith, right, I would say, look, this is costing the Albertan economy a significant amount.
The report also highlights the delay in approving new mental health drugs, taking up to 2.5 years, showing the need for more equal access, with Gregerson hoping to see change to help others.
I just think I'm just hoping that the report is going to bring out more awareness of some of the lives that can be saved by better attitudes, by better funding, by putting more research dollars into finding new medications.
From Edmonton, Adrienne South, City News.